Hi everyone, welcome to researchmd.com. We got a great presentation again today. Today we're going to talk about a common disorder, restless leg syndrome. Okay, again, my name is Pramil Cheriyath. I'm a director of research, internal medicine residency program director, transitional residency program director. I'm also assistant professor of medicine at Hackensack School of Medicine. So let's get into our subject. So what is the definition? Irresistible urge to move the leg, become worse at night, late evening and nights. Worse at rest, late evening and nights. Remember, irresistible urge to move the leg. The facts, it can affect all ages, more frequent when you're older, greater than 65, and the incidence could be like anywhere from 0.8 to 2.2% of the population. Now, there is two types of restless leg syndrome. One is called primary and the other one is called secondary. Let's look at the primary causes first, okay? Primary is one, we don't know the cause, no known cause. It could be familial or it could be like, some slow development of the characteristics of primary, okay? When you look at the secondary causes, main thing you have to worry about iron deficiency. That's why we make sure every time, when a patient with a restless leg syndrome, you check the iron level, which we'll come back to that. And renal failure and pregnancy could be rapidly progressive also. Remember, primary is slowly progressive and the secondary is like rapidly progressive. Okay, so risk factors, like if the patient is on antihistamine, dopamine agonist, antidepressant, neuroleptic, lithium, beta blockers, SSRI, and anticonvulsant, you're high risk of getting restless leg syndrome. Pathogenesis, pathogenesis is not very clear, but some of the things are we're talking about, like iron, decreased iron level, dopamine involvement of the dopaminergic system, other neurotransmitters, thalamic abnormalities, and network connectivity. Those are the things kind of mainly contribute to it. Symptoms, again, the leg irresistible move to urge to move the leg. Could be unilateral or bilateral. Could be one leg or both legs. Okay. Sensation deep inside the leg, aching, burning, tingling, tearing, throbbing sensation, feeling movement inside the leg, creeping and crawling sensation. Diagnosis, clinical diagnosis only. Again, there's no specific test we can do, unfortunately, but it's important to rule out the other causes. So what is the diagnostic criteria? International Restless Leg Syndrome Study Group came with a diagnosis. 1, urgency to move the leg. Number 2, uncomfortable and unpleasant sensation of the leg. Number 3, relief by movement. Number 4, worse by evening or night. If you have this 4, you can have restless leg syndrome. Now, labs, we have to make sure we do CBC, complete blood count, iron studies, check for vitamin B12, thyroid function studies, folic acid, and always kind of do sleep study also on this patient. Management, always the first thing we have to make sure, any of the deficiencies we need to replace it, okay? Replace if there is thyroid deficiency, vitamin B12 need to be replaced if it is low, folate level need to be replaced, sleep is low. Always correct the iron deficiency. If the ferritin level is low, like less than 75 micrograms, you should consider replacing iron. Vitamin C, helpful. Gabapentin and pramipexazole, and studies also shown like exercise is also very beneficial to this patient. Okay. Again, thank you so much for watching. Please subscribe to our channel. It will be very helpful so we can produce more more presentation like this. Thank you very much. Bye.